Welcome back to the second part of the screencast for the introduction to the drug tariff workshop. So now just looking at your questions given before. So first of all, we have the dental prescription. So the dentist tried to prescribe the omeprazole tablets, but as you can see here, the omeprazole gastro-resistant capsules are on the formulary. So unfortunately, that prescription as is would not be allowed. It would need to be amended to the capsules in order to be able to give it out. Now for question number 2 and the nurse prescriber, so this can be quite tricky because Epiderm isn't listed under E, it's actually listed under emollients. So you must go through the list of emollients and see if Epiderm or whatever brand is on that prescription shows up. So in this scenario, Epiderm was not on the formulary. So again, you'd need to contact the prescriber, possibly give them a suitable alternative like the Cetraben cream, and then ask the prescriber to change the prescription and send you over a new prescription for an item that is allowed on the lilac prescription. So now looking at part 16 of the drug tariff, so looking at endorsements and charges. So the endorsement on the front side of the prescription is really important for when your prescription is being sent off to be claimed, okay? So on the top left-hand side, you've got the pharmacy stamp. So this indicates who the dispenser was and what date the medication was dispensed. So this is important so you are claimed for correctly, and so if there are any auditing processes that the prescription, you can clearly identify who the dispenser was and what date the item was given out. The drug endorsement of medicines is also important, especially to clarify what you have given exactly. So if there is more than one pack size available for a drug that you are giving out, then you must clearly indicate which pack size you have given to the patient so you can get paid accurately, okay? And then you have the items supplied, so this will reflect how many fees the pharmacy team will get back, okay? So this is per dispensing item, how many fees will be allocated to the pharmacy. So on the reverse side, I've got an example of a dispensing token. So here is where you would now charge your patients. So currently in England, the charge is £9.35, and this is usually increased every April by the government. However, 90% of patients don't actually pay, so they are exempt. So along the left hand side of the reverse of the prescription, you'll see there are lots of letters, and all these letters indicate a different exemption, and the patient must tick a appropriate exemption box, sign at the bottom and date it to declare that they are exempt from paying a patient charge, and then they don't have to pay for their items, and the pharmacy team can then send that prescription to be claimed appropriately. So sometimes problems arise when we don't have evidence as to why patients don't pay for their prescription. So it's really easy if they're age exempt because their date of birth is on the reverse of the prescription. So that can be easily identified. Issues usually arise when patients don't have their medical exemption cards or their prescription prepayment emails, or even HC2 certificates or any income related letters with them. It's not something that they usually carry. So whereby you've not seen the evidence, it's up to the pharmacy team to cross the box in the bottom right hand corner, which I have circled in red, and that is to indicate that the pharmacy team has not seen any evidence. So now if the patient is unaware if they pay or if they are exempt, for example, if they've recently lost their job, so they may receive free prescriptions as part of universal credit, and us as the pharmacy team cannot guarantee that. What you can do is give the patient this blue form in the middle of the slide, and that's an FP57, and it's a refund receipt. So what you would do is charge your patient appropriately for however many items they are taking that day, fill out this refund receipt, stamp it with your pharmacy stamp, and then they can take that to any pharmacy and have their money refunded to them if they are able to show appropriate exemption details. So types of exemption details is what I've listed here. So it's a PPC, a tax credit certificate, a maternity exemption, anything that has been given to them to say that they are allowed to have prescriptions free of charge. So why are we charging our patients? So first of all, if we look at the prescription charges across the UK, you can see that currently England are the only country that are actually charging our patients. So Wales, Northern Ireland and Scotland now have free charges of prescriptions, but you need to think about their populations as well. So it may seem unfair, but they do have much smaller populations compared to England. So why are we charging our patients in England? So if we actually look at the number of prescriptions that have been dispensed, there are over 1 billion prescriptions dispensed per year. So imagine before I said about 10% of people are paying for their prescriptions and 90% are exempt. So if we charged that 10% of prescriptions our £9.35 charge, we are getting in £935 million of revenue just from prescription charges. So that's going into the NHS pot to then be dispersed through the sectors and funding lots of other things within the NHS. So now looking at professional fees, or Part 3A of the drug tariff. So remember when it came to endorsing prescriptions, on the bottom left hand box you needed to write the number of items that you have dispensed. So that usually relates to the number of fees that the pharmacy is going to get, and this is how much the NHS pays pharmacies for dispensing an item. So currently that's 90 pence per item, plus any additional payments for certain services that the pharmacist might provide. So again, you can look this up in the drug tariff, and it is again subject to change, similar to the patient charges and the drug reimbursement that we get. So this is something that you need to be keeping an eye on to see how much money you would be getting back from the NHS BSA. Charges and fees can be a really confusing subject because you need to understand the differences of a patient charge and a pharmacy fee. So remember, the patient charges are the item charges that you are going to be getting from the patient, and the fees is what you're going to get paid or reimbursed from the NHS BSA for the items you have given out and the work that you have done. So let's take the first prescriptions as an example. So you've got Ramipril 10mg capsules. So here you are giving out one item, so it's only going to be one item patient charge and one pharmacy fee. Now, how would this differ if we increase the quantity? So if the increased quantity is on one prescription, so for example now we need to give 84 or 3 packs, this would still be one charge and one pharmacy fee per item. The only time this would differ is if the patient came in and said, I'm going on holiday, the doctor has given me 2 prescriptions, each with 28 capsules on each prescription. In that scenario, because they are on separate prescriptions, unfortunately you'd have to charge the patient twice and you'd get 2 pharmacy fees. But as long as the quantity is written on one prescription, for example with the Ramipril 10mg capsules, 1 a day to give 84, that will just be one charge and one pharmacy fee. The time this rule would not be appropriate is for elastic hosiery. So we have to charge the patient one patient charge per leg, basically. So when we're giving out one box of a pair of elastic hosiery, we have to charge the patient 2 patient charges, and we will only receive one pharmacy fee in return. So even if they were receiving 2 boxes, so different to the ramipril capsules above, now because we're giving 4 elastic hosieries, we have to charge them 4 patient charges, but still in return we will only gain 1 pharmacy fee. Let's have a look at different formulations. So here we have a prescription for prednisolone gastro-resistant and prednisolone normal release. So here, even though that they are the same drug, because they are formulated in 2 different ways, so as a gastro-resistant preparation and a normal release, they will be treated as 2 individual items. So you will have to charge the patient 2 patient charges, and you will gain 2 pharmacy fees. Okay, so even though they are the same drug, it's 1 charge and 1 fee for each item of a different formulation. Sometimes combination packs can be quite confusing for pharmacy team members because they are packaged into 1 box. So if we take the Canesten Oral and Cream Duo pack, in here you have a capsule and a cream. So you have 2 different formulations of treatment, and so the patient would have to pay 2 patient charges and you would gain 2 pharmacy fees. Again, you've got different drugs, different formulations. Just because they're in the same box doesn't mean it will only be 1 charge. Still will have to be 2 patient charges and 2 pharmacy fees. However, with the Canesten Cream Combi, you've got clotrimazole as an internal and an external preparation, but they are all the same drug, the same formulation, the same strength. Therefore, it's only 1 patient charge and you will gain 2 pharmacy fees. Another rule you must remember is if there are different strengths or flavours of the same item, it would still only be 1 patient charge. However, the pharmacy will get 1 fee per item. So you'll see this for Ensure prescriptions. So when you've been working in a pharmacy at your placements, you'll see patients get these meal replacement drinks of lots of different flavours, and we wouldn't charge the patient individually for each flavour. But because we've had to do the work of counting the correct amount, making sure that all the flavours are there, we would gain 1 fee per item. This is also similar to this warfarin prescription, as you can see. So that it's all the same drug, the same formulation, just differing strengths. So here you need to think about it in terms of we're not going to charge the patient extra for making up their correct dose. Therefore, they would only need to pay 1 patient charge, but because you have had to do the work and check 3 different strengths of a drug, you would gain 3 pharmacy fees. So contraception tablets incur no charge. They are a free of charge medication in England. So the number of fees usually depends on the tablets. So for example, with this drug, you can see quite clearly in the blisters that there are 3 different tablets. So 3 different drug formulations. Therefore, you would gain 3 pharmacy fees. So when the next time you are at your placements, maybe see if you can open up these contraceptive pills, see what kind of formulations they are, if they're different tablets, and work out how many fees you would gain once you have dispensed this prescription. So now moving on to part 18A of the drug tariff. So here we're going to be looking at what is allowed to be prescribed on an FP10 prescription. So technically you can prescribe any medicine, food, drink or medical cosmetic item as long as it's not listed under part 18A or is blacklisted. So we call part 18A the blacklist, which means items you can't prescribe on an NHS prescription. Okay, so usually this is a long list of other drugs, food, cosmetic items that we are not allowing to be prescribed under the NHS. So as you probably remember from your EPS lectures, is that most items need to have a DMD code. So items having a DMD code is helpful because it will stop prescribers from prescribing certain food items that aren't appropriate on an NHS prescription. But however, they could handwrite a prescription for technically anything as long as it's not listed under Part 18A. So there are some exceptions to these rules. So there are a small list of items allowed in special circumstances. So that's called the selected sales list. So that's the SLS in Part 18B. And only appliances, dressings, and reagents that are listed in Part 9 are allowed on the NHS. We looked at the drug tariff, which showed us items we're not allowed to prescribe. So let's look at all of the items that we are allowed to prescribe under Part 18A. So the drugs that we are allowed to prescribe are listed under 3 categories. So category A is the popular generics that are widely available and usually of an average price list from a few wholesalers. Category M is more interesting, so these are readily available drugs. Usually the price is calculated by the Department of Health, dependent on information submitted by manufacturers, and they will adjust this price to allow pharmacists to have a reasonable income. So the Pharmacy Negotiating Committee will negotiate this deal for us. So you can have a look on the PSNC website as to exactly what they do. But this is usually something that has been arranged to allow pharmacists to gain a little bit more income. So category C is usually drugs that are available in a specific brand, and so their prices are usually set by the manufacturers. So not all licensed medications are listed in the drug tariff. As we said, there are always new medicines coming out, things being taken off of the market. So not everything is listed in there, but the majority of drugs are. So you need to familiarise yourself with the symbols that are found in Part 8A. So the circle symbol identifies anything that requires reconstitution. So these will be items coming into the pharmacy as dry powders, and you would need to make them up on premises when dispensing a prescription. So usually for these you will get paid for the nearest whole pack to cover the quantity required on the prescription. You then have the square symbol of special containers. So these are items which can't be split easily in the pharmacy, and so again you would need to supply the full pack and to the nearest quantity that has been prescribed, and you will get paid for giving the complete pack. And as mentioned before, the selected list scheme or the selected sales list is going to be some items that are allowed on the NHS but for specific reasons. So again, you can have a look at this in Part 18B and have a look at what drugs we can prescribe for which ailments. Looking more specifically at the selected list scheme in Part 8B. So here, as I mentioned, it's a small number of items that are allowed to be prescribed under special circumstances. So there is a list of certain medical conditions that have been identified in the drug tariff. You can have a look at that. But what you need to remember that the prescription must be endorsed with SLS in order for you to be able to dispense the prescription. This is so the NHS BSA know that the prescriber has identified this patient to have a specific ailment, and so this drug is appropriate for them. So in order to be paid appropriately, the prescription must have SLS written on it, otherwise the prescription will be disallowed. As mentioned before, special containers are given the symbol of the black square, and these are usually items that must be kept in their original pack. Okay, so this is usually where they are sterile, effervescent or hygroscopic, or packed in an aerosol, tube, roll-on, spray, sachet, anything that can't be split practically on a pharmacy premises. It also includes liquids for addition to bath water, coal tar preparations, and viscous external preparations like creams and ointments. Again, all items which can't be split easily within a pharmacy. So here you would now need to think about the halfway pack rule if a prescriber has prescribed you an item not to the pack size which is able to be dispensed in. So for example, this would be a prescription quantity that is 1 plus half or less than half a pack, in which case if it's less than half a pack then you would need to round down. So for example, there is a 100ml pack size and a 250ml has been ordered. You need to round down to the nearest whole pack, which would be 2 times 100ml. If the prescriber had prescribed 251ml, you could have then rounded up to give 3 times 100ml packs. Okay, so because it was less than 1 plus half of a pack, you needed to round down. But if they had prescribed 151 mils, which is 1 plus half of a pack size, you are then able to round up. So the only variance to this would be antibiotic mixtures. So they have a special concession under clause 13, and this is you need to give enough of an antibiotic to complete its full course. So regardless of how much the prescriber has written on their prescription, you can endorse appropriately and round up in order for the patient to complete their antibiotic course, and you will get paid in full. So now moving on to borderline substances in part 15. So borderline substances include a list of foods and toiletries which can be prescribed on the NHS. So these are like the Ensure drinks that we were talking about earlier on. So this is where the Advisory Committee on Borderline Substances advises in which medical conditions these items can be prescribed on an NHS prescription. So list A is an alphabetical index and list B is an alphabetical index of the conditions and products suitable for these conditions. Okay, so list A is just an easy way to find out if the product is able to be given on an NHS prescription, and then list B will indicate any suitable conditions. So within a pharmacy, you may be specifically looking at list A, for a GP practice, whereby you are ordering the medication, you definitely would need to look under list B and look at the patient's conditions as well. So again, the annotation of ACBS must be written on the prescription by the prescriber to make sure that the list has been checked appropriately and that the borderline substance is appropriate for the patient and so can be supplied on an NHS prescription. We briefly spoke about endorsement rules previously, especially considering pack size. So if we look at the first example, this is an example of why we must endorse for multiple pack sizes. So you've got a prescription for paracetamol that's available in a pack of 32 or 100. So you would need to clearly identify what you have given. So in this scenario, we had given 60 out of a pack of 100 and so have endorsed this appropriately. There are more endorsement rules, so now let's go on to number of days treatment. So sometimes the prescriber won't give you a quantity, they'll give you a number of days treatment, so you will need to work out exactly how much of the drug you need to give out to the patient. So for this cefalexin prescription, you can see that yes, there's only one quantity of cefalexin available, but you would have to endorse in this scenario because the prescriber hasn't given you a quantity, they've given you a number of days treatment in the sort of top middle box. Okay, so they've told you we need to treat for 7 days. So you're going to give one 250 milligram capsule 4 times a day for 7 days, and so have endorsed that appropriately as giving 28 capsules from a 28 box or 1 times 28 box. So if it was an item that's not listed in Part A, So I did mention that there are always new drugs coming out, so this can happen. You may have an NP8 item, so a not listed in Part 8 item, and here you would need to endorse the brand name, the pack size, and the price of the item, which you would get from your wholesaler's invoice, so the NHS BSA know exactly how much to give you. So we've looked at items that are included in the drug tariff and not included in the drug tariff, and how the NHS is going to reimburse you for those. But now let's have a look at how you can endorse for any relevant claiming fees. So these include the BB, the OOP endorsements that you may have seen on prescriptions. So what they would do is confirm exactly what was supplied, the number of packs that has been supplied, and if you have incurred any extra charges or any extra fees. Usually the rule is, if in doubt, you should endorse. And what would you do if you decided not to endorse an item? So here on the prescription, you can see that the second item we have decided not to endorse. So that would be not given out due to patient preference or it's clinically inappropriate. So you would need to endorse the prescription appropriately by scoring through the item and writing ND in the endorsement column. So let's look at those claiming fees for any additional payment that you need to receive in a bit more detail. So I mentioned the BB endorsement, which stands for broken bulk endorsements. So this is usually a payment that's given to you for a complete pack, even though you have only dispensed part of a pack. So this is usually for an item that you have ordered in specially for a patient as a one-off item, and you're not going to use it again in your pharmacy, so you would need to be paid for the entire pack. So items that wouldn't be included in this is anything that you are likely to keep dispensing throughout your day-to-day work, or if it is dispensed again within 6 months. So then the drug cost is adjusted and taken off the first dispensing. So this would count for any drug or appliance in Part 9, but not any unlicensed or specials products or categories A and M if the smallest pack size is less than £50. So if you've given a generic item under category A or M that's fairly cheap, unfortunately you can't claim broken bulk on it, but you would be able to claim broken bulk on any specialist items that you have had to order in that are over £50, okay? Also for any appliance that is listed under Part 9A. OOP endorsements or XP endorsements stands for out-of-pocket endorsements. So these are usually expenses charged to the pharmacy by wholesalers and usually are a postage and packaging or a courier fee for the transport of their medicine. So remember we spoke about category A or M being readily available drugs from your main wholesalers. That's why you can't usually claim for an OOP courier charge from your main wholesalers. So anything listed in category A or M, you can't claim for this. But if you are going to claim, you must endorse your prescription as shown with the OOP or the XP and the amount that the courier has charged you or the wholesaler has charged you, and usually you can claim for anything more than 50p. So now we've looked at items that you can prescribe on the NHS and how to endorse those accurately. We now need to send our prescriptions off to the NHS BSA for our end of month claim. So your FP10 prescriptions or your paper prescriptions are sent at the end of the month in a similar way to this picture is shown. So all packaged up together, sent to one of the hubs whereby the NHS BSA will reimburse your claims. But luckily now more than 80% of prescriptions are electronic. So as the item has been given out, the prescription will be scanned to be claimed, and the claim would automatically be sent to the NHS BSA, usually done on a daily basis. So all of the endorsements and the fees and any cost of the medication is all done electronically, and all of the same endorsing rules apply as the paper prescriptions we've taught you. It would all just be done on your electronic PMR system. So both electronic and paper fee claims and number of charges to patients are counted, and a paper form with this data is submitted to the NHS BSA. So you would count up all electronic items that have been given out, all paper items that have been given out, and then send a paper copy over to the NHS BSA with a total number of prescriptions done in the month. So the significance of these red separators is to ensure you get accurate payment. So often you will have FP10 prescriptions that are handwritten, or whereby the prescriber's signature is covering any of the text, or the prescription itself might be a bit difficult to read. So because normally prescriptions would go through a supercomputer scanner, these items can be checked individually by a person to ensure that they are reimbursed correctly. So other prescriptions that you may want to put in the red separators would include anything whereby you've endorsed a broken bulk, an out-of-pocket expense, or any expensive items or specials, so that somebody can check those accurately and then be able to reimburse you the correct amount. And as checking these prescriptions can be quite a long process, usually the pharmacies will get their reimbursement of their fees, their drug costs, and any other endorsements within 3 months. And this will be minus the patient prescription charges paid by the NHS. So you've charged your patients a certain amount for their prescriptions, so then the NHS BSA will count up how much they owe you in fees, drug costs and endorsements, and minus off any £9.35 charges that you have taken from patients that month. We've had a basic overview of the drug tariff, and we know that it describes the conditions of the community pharmacy NHS contract. So it's key to remember the rules to follow when dispensing and endorsing, how to charge patients, and how to claim for payment accurately. We need to remember that it is updated every month, so we need to keep an updated reference in the pharmacy or use the online portal, and we need to remember that it is not a clinical reference. So that's all for today. Thank you so much for listening. I want you to have a look at the next slide, which has some MCQs, and if you have any major questions, please feel free to email me. Thank you.